socialEdge interviews social entrepreneurs who tackle some of the world's biggest problems. They are pioneers of innovation that benefit humanity.
My name is Elias, and I'm the president of PATH, which is the Program for Appropriate Technology in Health. And I'm based in Seattle, Washington, which is where PATH's headquarters is. But we work all over the world. We have 29 offices in 20 countries around the world and are active in 65 or so countries. Our mission is to improve the health of people around the world by combining advancing technology, strengthening health systems, and encouraging healthy behaviors. And the secret to our success is the realization over the 30 years of PATH's history that if you really want to improve people's health, you have to do all three of those things. If you just develop new technology, even if it's low cost and appropriately designed, it'll generally just sit on the shelf unless you combine it with efforts to strengthen health services, health systems for delivering those innovations, and work to improve healthier behaviors, to help individuals and communities adopt and sustain healthier behaviors. So many of our programs represent a combination of those three things: technologies, better systems, and healthier behaviors. Shortly after I finished my medical training, I had gone directly from medical school into a residency program where I was training in fancy hospitals in San Francisco. And then after that, found myself working on the Thai-Cambodian border in refugee camps. And I went there with all the latest medical training and tools of my profession, and wound up working in a hospital with dirt floors and bamboo walls and no electricity and no running water. The first year I was running a pediatric clinic, training people to take care of the 300 or so sick children that were in the hospital at any given time. And found it was very rewarding, but at the same time very frustrating, because most of the diseases that we were treating were preventable. And so the second year I was there, I really shifted from clinical medicine to primary public health care, and using my skills and resources to do public health outreach and to prevent a lot of the diseases that we were seeing in the hospital. And as a consequence, it really influenced my career. I came back after that, did some more training in public health, and then have dedicated the rest of my career to working in public health and using medical skills to prevent as opposed to treat, although obviously working to treat illnesses when they occur. And some of that transition was brought about by particular individual Cambodian children that I worked with. One in particular I remember, who was in our feeding center because he was trapped in this cycle of infectious disease and malnutrition and just didn't seem to be able to get out of it. And it took 6 months of intensive treatment of his illnesses and supporting his nutrition to turn him around and see him become a healthy child. And so that combination of preventive medicine and public health really was brought to me in that early experience in my career, and has really informed all that I've done since then. Well, if I think about what I wish some people had told me when I was a young social entrepreneur, I think there are really three pieces of advice. The first is to always question, to be skeptical every time you feel certain of something, because change requires that we constantly question the assumptions that we take for granted and that so many people tell us have to be the way they are, and usually they can be changed. And so constant questioning, I think, is one piece of advice. A second thing is, if you're questioning, you're also looking for answers, and what has always been important for me is to look beyond the predicted fields of answers. So talking to many people in many disciplines and learning their perspectives, seeing how they redefine frame problems and their solutions has been a source of constant invention and stimulation for me. And then thirdly, I think is important to reflect about balance, about how you find balance in your life. and that balance isn't going to come every day. There will be periods where you have to work flat out for weeks or sometimes months on end. But that in the long term you do need to find balance between work and life, between professional and personal development, and meeting the timelines and deadlines of today. Everybody defines balance differently, and again, it won't happen every day, but over time it really is essential to being able to sustain the energy to be entrepreneurial.
Global X is also on Social Edge at socialEdge.org.